Hello everyone and welcome to this instructional video on capillary blood sampling and hemoglobin estimation using a point-of-care device. Point-of-care device is a medical device used to perform diagnostic tests and get immediate results at the patient's location without the need for laboratory processing. In today's video, I'll walk you through a step-by-step guide on how to properly collect a capillary sample and estimate hemoglobin levels. Before we start, let's first go through the equipment that you'll need. Sterile lancet for capillary puncture, alcohol swab for disinfection, microcuvette for sample collection, gloves, and of course, the point-of-care hemoglobin analyzer for hemoglobin estimation. This is the point-of-care hemoglobin analyzer, a portable, easy-to-use device that provides rapid and accurate hemoglobin readings on whole blood sample. Once the sample is collected in the microcuvette, as explained later in the video, it is inserted into the cuvette holder, as you can see here. Then you gently push the cuvette holder to its measuring position, and within a few seconds, it provides the hemoglobin result, which can be easily read on this digital display. Next, we have the safety lancet, designed for quick, hygienic, and virtually painless blood sampling. Unlike traditional lancets, this safety lancet has a retractable needle, minimizing the risk of accidental needle stick injuries. It's a single-use device, ensuring safety for both healthcare provider and the patient. Finally, we have the microcuvette. This small capillary action cuvette is used to collect blood sample for analysis. Once the sample is collected, it's automatically drawn into the cuvette through capillary action. Microcuvette is made of polystyrene plastic and has no reagent. Hence, once the blood sample is drawn into the microcuvette, it needs to be analyzed within 40 seconds. Make sure to handle the microcuvette carefully, as air bubbles or mishandling can affect the quality of the sample and the accuracy of the results. Make sure all the equipment is clean, sterile, and within easy reach before you begin. This will ensure the process is efficient and contamination-free. With these tools ready, we can now begin the procedure for capillary sampling and hemoglobin estimation. Before performing the test, you have to do hand hygiene by either washing your hands with soap and water or using an alcohol-based hand sanitizer. Next, you have to put on your gloves. Now ask your patient to sit comfortably with the hands relaxed. The position of the hand should be at the level of the heart to ensure adequate blood flow during sampling. You can choose either the middle finger or the ring finger for sampling, and preferably the side of the finger is used as the puncture site, not the tip of the finger. Now take out an alcohol swab and clean the finger in a circular motion. Now wait for the finger to air dry. Now twist the tip of the lancet. Hold the finger firmly and press the lancet like this. Now you have to wipe first 2 drops of blood by using a sterile dry swab. Now take out the microcuvette, and after a proper drop of blood forms, touch the tip of the microcuvette at a slight angle. You can see that the microcuvette fills up by capillary action. Now you have to wipe the excess blood from the microcuvette. Now open the holder of the microcuvette like this. Place the microcuvette in the slot and close it. You can see that the reading has been displayed within a few seconds. Now open the slot, take out the microcuvette, and dispose of all the wastes according to biomedical waste management guidelines. Now remove your gloves and sanitize. That brings us to the end of this video on capillary sampling and hemoglobin estimation. If you have any questions, doubts, or queries related to this topic, feel free to ask in the comment section below, and I'll be happy to address them. Stay tuned for more informative and educational videos, and don't forget to subscribe to the channel for updates. Thanks for watching.